is O.M.A Medical Studio. We are back again, and this is Friday Hospital Diaries, where we talk about some of the events that do occur in the hospital. I think our last episode is I spoke about how a certain family administered antihistamine, that is a sedative drug, to a child, and then the child went to sleep in school. Apparently, the child fell from the chair, and then the school authorities were thinking that the child had what collapsed. They rushed the child to the hospital. Fortunately, the parents came along with the medication the child was on. So we got to find out that the child had nothing wrong with him except that he had been given sedative. So basically, he went to school to sleep instead of staying at home. And today I have here with me a colleague of mine, and he's going to take part of it. The interesting part of it is that he has no knowledge on the case we are coming to discuss. So I'm just going to read out the events that occurred, and then we all have reactions. You also let us know your views on on this particular event in the comment section. Before I start, do you have anything to say? Do you have any expectations?
Not really, because I don't really know what I don't know what I'm thinking. Well, you caught me by surprise. Yeah.
Okay, so today's case is a very interesting one. I mean, it didn't happen in my facility, but it happened in a colleague's facility, and then we just decided to have a view on it. All right, so I read out the case. There are certain words he used, but then I'm not going to mention them. Right. So according to this colleague, a client visited the hospital,
Yeah.
and then it complains of vomiting and then abdominal pains. Now, what happened was that when the vomiting, according to him, when the vomiting and abdominal pains subsided, he, the client, would not accept their diagnosis. So I'm reading directly from it. When the vomiting and abdominal pains subsided, he would not accept our diagnosis because to him, his only problem is ulcer and that the urethral discharge was normal, something that comes and goes. This was someone with bilateral renal angle tenderness. The urinary was so terrible, the BBC elevated, and H. pylori negative. He didn't do the scan and was due for the next dose of medications in an hour. The sister, who claimed she was going to bring him food hours before, never returned to the facility. Anywhere I had seen this guy, I had stoned him fair. The pressure they put us in the beginning only for them to run away.
That's crazy.
So, Charlie, we problems to see for this particular one.
Okay, can I ask a question?
Yeah.
In the statement you made us know that he didn't accept the diagnosis.
Yes.
What was the diagnosis, and how did he understand the diagnosis?
Reading from this, see, people come to there's this thing, there's this accession thing. A lot of people go to the hospital because they're in pain, not because they have immunity. They can be sick for a very long time, but until pain comes, they never go to hospital. So when you read from this, it said, when the vomiting and general abdominal pain subsided, right? So basically, it was in pain. That's why he came. And then there are these things happen.
So the thing is that number one, if your pain has subsided, let's take pain for instance. If your pain, or from the case you read from, his abdominal pain subsided, right, and the vomiting has subsided, then because it has subsided, he said he wants to go. He wouldn't continue the treatment. So I feel number one, we should have the health, your colleague or anybody that saw the case should have explained to him the reason why he needs to continue the treatment, the reason why he needs to follow the regimen, the consequences of not aligning himself to the treatment, or the consequences of him not continuing the treatment.
But like, would you attest to the fact that there are some people who get to know all this to the whole?
Yes, that's what we have. So
Yeah, some client will face stress.
yes, yes, it does happen. It does happen. You see, they feel okay, I'm okay. So whatever you are saying, like the person is, I'm fine. So there's no need for continuous treatment.
Crazy.
Yeah, they feel so what happens is that those kind of people, mostly when they have the symptoms, they go to the drugstore or the pharmacy first. Then when it fails them, then they come to the hospital.
See, one interesting thing is that when they leave, when they have gone, or probably they ask for discharge against medical advice, and then they go, and symptoms will okay. The next place they go, they will not go and say whatever they did.
Yes.
They will not go and talk about the events that took place for their discharge. The only going to be like, we went to this hospital, they discharged us on this day, and then symptoms are. So at the end of the day, I'm thinking about reputation. Which hospital did you go to? I mean, they give directions and manual. Why would they discharge a case like this? It's a whole lot of things.
Some people ankasa
Like
like
just like that.
they're just like that. No matter how you explain the consequences, to them they are just naturally that's how they are.
Coming back to this case, I mean, this person went to general abdominal pains and vomiting. So obviously, he in his mind he had ulcer. He has been treating ulcer, because according to the theory, that was his only problem. But then he made another complaint with neutral discharge
Discharge.
and then bilateral renal endothelioma, possibly genitourinary,
Yeah.
basically. UTI, genitourinary, all of these things. I mean, I don't want you guys to bother yourself. The whole event is on why people go home against medical advice, why they shouldn't go, the effect it may have on them. Now, when you get to facility, basically a lot of things are done on you. Get to know. There are certain things you might not even know that those are the cause of the problems. It's left to your clinicians and the health workers working around you to tell you that. But if you feel symptoms are just the physical things that appear to tell you that there is actually something wrong with the body. So if you come in an emergency state, you are supposed to calm the symptoms down. The only way the symptoms will be cured is basically when we tackle the case from its basis. If you think the symptoms have subsided and you want to go, I mean that's so upset. It's not something we even have to encourage. What's your last take on it? Like for this particular client. I mean, if you are watching us and you are the one there, seriously. What's the last take on it?
Okay. For me, I still think
But do you think it was a plan? Because his sister claimed was
it was good. Yes,
going to
I felt
never
it was a
give her.
planted. Yes. So wait, did the man actually abscond or he refused the treatment and was asking for a discharge?
This. He didn't do the scan and was due for the next dose of medications in 1 hour. His sister, who claimed she was going to bring him food, never returned. Anyway, I'd see that guy, I'd stone him, pressure they put on us. So basically, he asked for discharge against medical advice. I don't think he asked for discharge against
Yes,
medical advice. And he would not accept the
the
treatment.
treatment.
So, I mean, whichever treatment they were going to give, even after discharge against medical, he
He
wasn't
wouldn't.
going to.
Yeah. Yeah.
That's
Yeah. But so if this person goes and comes back, will you, if you are the one that saw the case, will you see him again or will you?
oh, me before you go, I'll tell you that don't come back.
Is that also right?
Yeah,
That
it's
one
right.
I is that right?
It's right.
Why?
Even now, me as a clinician, I have the right to choose which patient as well.
Really?
That's ethical. There are patients because of your emotions and things you can't attend to. So you need to make a choice.
Okay.
Yeah, the same way the patient also has a right to choose which patient. So you can have conflicting outcomes where you don't want to attend to the patient, but the patient wants.
To you.
Yeah.
Yeah.
I mean, before you take a discharge against medical advice, it means that you are taking responsibility as to whatever the outcome may be. But I tell you, if you get worse, don't come. If you come, the best thing I can do for you is to refer you. Because at the end of the day, if you have started something to improve your symptoms, and we are going to continue it, you've distracted it.
Yes.
You disrupt the whole thing. It means we need to start again.
Okay.
Because some of these things, because of our system, when they come, you don't recognize them. That these are the people,
Yes.
but there are certain conditions that are very unique. When they come, you know them.
It's true.
Those who come with malaria and
Malaria.
things, you not recognize them that they are the people who are suffering. But then there are some chronic conditions you know
No.
because they will
It's
stay
true.
with you for
For
long.
long.
Oh, I was in a consulting. I was coming out to attend to a case at the OP, and I saw him sitting joining the queue. Why? What happened? What are you doing here? He couldn't talk.
Yeah. But in that sense, would those who see you or the facility or within that like that within that period, would they see you to be bad? Or would they see you to be like wicked in a way for not accepting them back?
We don't manage cases with sentiments. How you feel. I mean, whatever you want to do in medicine, it has been done before.
Yeah.
You are not the first person to do it. It has been done before. So it's not about the way you feel about it. It's about what you have to do and what you need to do at that particular. People can have genuine reasons, you know.
And you, the clinician, will side with them.
You see, this is against your advice.
It's like, there are some people have
Yeah, you
genuine
see, the
reasons.
fact that you have genuine reasons doesn't mean it goes with my
Okay,
thinking. I
okay,
mean, you can have a genuine reason to withdraw yourself from an event in the hospital. That doesn't mean the hospital management will forgive you.
okay.
Oh, I have an
Yeah,
emergency, I'm going somewhere. But meanwhile, they also want you to do something. You have a genuine reason to go.
yeah.
But that doesn't mean the hospital has
I
to tell
get
you.
it. Yeah,
So yeah, I mean, asking for Dama is scary, it's dangerous. Whatever be the case, if the hospital, if your clinician wants to treat you, I think you should side with them. Sometimes some of these things are monetary issues too. That you can't really do much about. Even you as a clinician, you can't do much. You don't have any option than to side with them because money is money. If you admit them and they can't buy the gas, oh,
yeah, yeah, yeah. Money next choice.
so sometimes just me if it comes to money and you're asking for discharge against mental health, one of the things I tell you probably get to some one. I mean, if you're in the private facility, you can ask for the referral to government sector where they have the social welfare.
Yeah,
They can consider
yeah.
seat for
But does it really work?
it works.
Yeah.
It works. It works, yeah. Especially in this kind of hospitals, the social welfare. I'm not asking you guys to be moving there. So, all right. So this is Friday Hospital Diaries, and this is one of the events that occurred. It's scary. You understand? You go to hospital, diagnosis is made, and you don't believe in the diagnosis. The only thing you think about is what the ulcer you are suffering from. You don't think you are done with it. This might go on to affect you some years
Yeah,
to come.
people think it doesn't really have an effect on them.
Okay, long
Yes,
term.
they don't really think it has an effect on them. They think, oh, I'm done, so me who yeah,
This
I'm
person
fine.
has a urethral discharge basically from these things, these
Yeah,
STIs.
you get
Now
it.
you're having renal tenderness basically that has gotten to
That
your
yeah,
kidneys.
yeah,
So can go on to affect you, your sperm count, all of this. Some of these things come from all of these basic things we run. All right, so this is where medical should be. We come your way.